After a hair transplant, you're going to have some swelling. It typically subsides within 3 to 4 days, roughly. The donor site where we take the grafts from, the tiny holes close up by day roughly 5 to 7. Where the recipient site where we place the grafts, they turn into little scabs and are flaked off by 2 weeks typically. After a hair transplant, the transplanted hairs go into what's called telogen effluvium, which is a dormant phase. They start coming out of that dormant phase roughly 3 to 4 months post-transplant is when you first start noticing initial growth, and then more and more and more turn on until you reach your final density 12 to 18 months post-transplant. The success rate of hair transplants is extraordinarily high. I won't want to say 100%, but we're close. Roughly 95-98% of all the grafts turn on and turn into new hair. And we take a lot of extra precaution here. We use special bathing solutions, which allows them to be outside the body longer, maintaining normal metabolic function while they're awaiting implantation. We also do a PRP treatment with every single transplant to make sure that we give them the best possibility to survive and turn into new hairs. Yeah, there's basically two types of hair transplants, FUT and FUE. FUT stands for follicular unit transfer, and that is what's also classically called strip method, where you're removing an entire strip of scalp. You're getting stitches and staples in the back of your head. We do not offer that at Kalos because we believe that you can do FUE, which is follicular unit extraction, where you're taking the individual hair follicles out of the back of the head, not leaving a scar in the back of the head in order to be able to transplant it where you need the hair. It avoids a linear scar, avoids people having to modify their hairstyles down the road. It also reduces the healing time so you can return to activities faster. Hair transplants are an extraordinarily safe procedure with virtually no side effects or risks associated with them. You will sign consent forms that do list risks and potential side effects. They've never really happened.